All right, I'm going to demonstrate how to line nasal intubate a patient. I've assessed my patient and he requires ventilatory assistance and other airway measures are ineffective. So I'm going to have my proper personal protective equipment on, gown, gloves, mask. I'm going to assemble all my equipment. I have a syringe, I have my two nasal tubes, I have lidocaine and Otrivin. I'm going to establish the patient into the proper position. Preferably we like him sitting upright. We can come back from a rear position to do this, but it's kind of hard with this mannequin, so we're just going to make do with this. I'm going to ask my partner to pre-oxygenate this patient prior to initiating the procedure. I'm going to have a look in the patient's nose, make sure it's patent. I don't see any obstructions in there. I'm going to go ahead and spray 2 sprays of Otrivin in each nair. I'm also, because he's conscious and he has an intact gag reflex, I'm going to spray, he's an over 40 kilogram male, so I'm going to spray 10 sprays of lidocaine in the nose and in the mouth, thus suppressing his gag reflex. I'm going to grab my tube. It's a size 6. I'm going to insert it, bevel edge towards the septum, inserting it. I've already told this patient, got his consent and told him exactly what I'm doing. I'm going to advance the airway. I'm going to pull, but once I get close to the trachea, I'm going to pull up on the trigger to move it superiorly. And once I've determined it's in the trachea, I'm going to inflate the cuff. Cuff is inflated. I'm going to ask my partner to attach the BVM, and we're going to auscultate over left lung, right lung, over the epigastric region, the trachea to make sure the cuff is still intact. Okay. I'm going to monitor. I'm going to note the depth of the tube, just to make sure once we move this patient that it's not dislodged. I'm going to continue to BVM and monitor and reassess, and I'm also going to tape and secure this tube. I'm going to tape and secure this tube to the patient's face. Tape, smaller tape.
Okay, where's that other one?
Okay. Swatch your hand there. All right, tube is secured in place, and like I said, we're going to continue to BVM, monitor and reassess the patient's airway as we go, and we'll troubleshoot as necessary. Keep watching the end tidal, make sure we haven't dislodged, and that's it.